fellow Guwahatians with relatives abroad waiting to come back home, for those who live abroad and are planning a trip back home or just to explore the beautiful Northeast, the Assam government has released new SOPs. Here's everything you need to do if you or someone you know is coming back to Guwahati from abroad. The new regulations have been put in place to contain the spread of the infectious Omicron variant. Any air passenger landing at Guwahati Airport will mandatorily require registering online by submitting a self-declaration form in order to be even allowed to board the flight. The form will again be asked by airport security after deboarding. All passengers must submit 14 days travel records. This would be done to identify passengers from at-risk countries. Those found from traveling from at-risk nations will be subject to additional measures, which we will get to after the generic rules applicable to all. All passengers must carry a negative RT-PCR report. The test must be conducted at least 72 hours before boarding the flight. Apart from the self-declaration form, during online registration, 14 days travel record and RT-PCR report, travelers must also submit a declaration form, reassuring that all the documents submitted are authentic. If found otherwise, the traveler will face criminal prosecution. Then, you would need an undertaking assuring to abide by the quarantine rules warranted by the appropriate government authorities. The undertaking can be submitted at the portal or to the Ministry of Civil Aviation through their respective airlines. All passengers will be thermally screened before boarding and after deboarding. Only asymptomatic passengers will be allowed to board, and travelers will be monitored for symptoms even during flight. Another requirement for all air travel within India is the Arogya Setu app. You might already have it downloaded from your previous trips. If not, download it as it is indispensable to any air travel within India. Last but not the least, the basic tools at our disposal to save ourselves from infection, masks and social distancing, are a mandate. If a traveler from a non-risk nation, which is not an at-risk nation, tests negative, he will need to self-monitor their health for 14 days. The state and the district administration will be in touch with all international travelers arriving in the state for follow-up tests or in case they develop symptoms or test positive. However, if you are arriving from at-risk nations or if you test positive upon arrival, additional protocol have been put in place. Travelers arriving from at-risk nations will be required to get tested upon arrival even if you manage to produce negative RT-PCR report taken within the last 72 hours. Those from at-risk nations would need to submit their samples and wait for their results before boarding their connecting flight. This test would be self-funded. Those found positive will be put in isolation facilities and treated, and their samples would be sent for genomic sequencing to identify the strain of the coronavirus. Then the contacts of those testing positive will be traced and isolated as per their test results. Those negative but symptomatic will be contacted by district surveillance units on day 2 and day 5 and tested. Those negative and asymptomatic after arrival will be tested after 7 days of home isolation. If you tested negative and are asymptomatic after arrival and you again test negative after 7 days, you will still need to quarantine at home for 7 more days, taking the total quarantine period to 14 days. Travelers under home quarantine who develop symptoms must immediately self-isolate and get in touch with their nearest health facility or call the government's helpline, which is 1075. So if you're planning a trip to the Northeast through its gateway Guwahati, or just returning home after a very long time, you know what you have to do. Hope you've made a checklist. This is Niharika, signing off.